Hello, Ms. Matthews.
Hello.
Hi, I'm Dr. Mudlia.
Hello.
I'm one of the psychiatrists. I understand from the information I've been given is that you've come to talk to me about Alicia, one of your patients.
That's right, yes, thanks for seeing me.
Yeah. What would you like me to call you?
Oh, Laura.
Laura.
Yeah.
Laura, thanks for coming and seeing me today. I understand from the GP's letter that there was some blood tests done on Alicia, and he was concerned about the potassium level and the phosphate level.
That's right, so they were low, yeah.
Okay, so I just need to ask you a few more questions about how Alicia's been.
Sure.
Has there been anything you've noticed with her?
Well, I did go to see her today and I was quite concerned. Her lips were swollen, she had edema in her legs, and she complained of difficulty swallowing as well.
Okay, and was this the first time you've noticed this?
Yes, it is, yeah.
Okay, and I understand she's been in the community. She was recently discharged from hospital.
Yes, we've been managing her in the community for about 5 weeks now, and she seemed to be doing okay. But then obviously we've had these blood tests come back, and then when I went to see her today, her mother, I was coming anyway, but her mother had said, had I not been coming, she would have called me. So.
Okay, so it seems like that people are concerned about the way Alicia's presenting.
Yes.
Has there been any changes in her diet recently?
Well, I did check with her mother, because we did have her on quite a, it was a regulated programme, and her mother said she'd shown signs of being happy to eat a bit more, so her mother has been giving her some quite high calorie puddings and snacks, anything really that Alicia fancied, so she's quite dramatically increased her calorie intake.
Okay, and do you know how much per week has she been gaining?
She had been gaining 2 kilos a week, but I weighed her today and she'd put on 3.5,
so she's gained quite a bit of weight in a short span of time.
Yeah.
Okay, and do you know what has been her community treatment plan?
Well, she's been seeing a dietitian. I've been seeing her once a week, weighing her each week. The GP has visited, and she's been to the GP for blood tests on quite a regular basis. And she had her meal plan from the dietitian, which her mother was following.
Okay, so Laura, from what you've told me, you've said that Alicia's recently gained a significant amount of weight, and she's started increasing in her diet.
Yes.
And she's also presented with some physical symptoms of swelling of her lips, her legs, and swallowing problems.
Yes, that's right.
And there's been some blood tests with low potassium and phosphates of concern. So I'm thinking that I think what Alicia has is possibly refeeding syndrome. I'm not sure whether you've heard of this before.
I can't say I know exactly what I've heard of it, but don't really know anything about it.
Okay, well, I'll explain to you. Refeeding syndrome, as the name suggests, is when it occurs when someone gains too much weight or eats too much too quickly. So, which sounds like in Alicia's case, where she's just been discharged from hospital and she's gained about 3 kilos in a week.
Yeah.
And because of her having more food intake, she's developed this.
Right. Yeah. I mean, what exactly is refeeding syndrome?
Yeah. So it usually occurs in people when they're either malnourished and they start to eat quickly, or when sometimes in cancer patients when they're on enteral feeds, when they get nutrition input quickly. So it can occur in various different other disorders. And what happens is it's to do with the electrolyte imbalance. So like we've discovered with Alicia's blood, the potassium and the phosphates became low. So what happens in refeeding syndrome is when the body shifts from fat metabolism, when someone's starving, to carbohydrate metabolism.
Okay.
Yeah. Are you following me so far?
I am. Yeah, that makes sense.
So that causes a shift of electrolytes like potassium and phosphates.
Right.
And as a result, the symptoms which they experience is what we've discussed already.
Yeah. Yeah.
Like you've told me, Alicia's lips were swollen, her feet were swollen, she had swallowing difficulties.
Yeah.
Sometimes it can present with nausea and vomiting, abdominal pain and constipation.
Right.
Are you following me so far?
I am. I mean, it sounds a bit alarming, is it?
Yes.
Is it dangerous?
Yes, I mean the complications, I don't want to alarm you, Laura,
Right.
but it is a medical emergency and we do need to get Alicia into hospital. Because complications is it can be quite fatal. They can end up into renal and cardiac failure. They can have seizures or go into septicemia. So it's a concern at the moment, and I'm glad you've come today to discuss this. We do need to take her into hospital.
Okay. I mean, I can get in touch with her mother, and her mother drives, so, I mean, would it be okay for her to bring her?
Yes. I mean, in hospital, what we would need to do is obviously we'd need to work closely with the physician and the medical ward.
Sure.
They will need to admit her, they will need to monitor her vitals, her blood pressure, her pulse, and they would need to treat any underlying conditions, like sometimes they can get hypothermia. Or sepsis, so they would do some bloods to identify if there's any other underlying conditions. And then we'd need to get obviously the dietitian involved as well.
Sure.
To look at how much, what her weight is and what food she would be able to have. So there is a lot, obviously I've told you in terms of getting her into hospital and ensuring that she's getting the right medical treatment.
What would the prognosis be?
Well, the prognosis is good because now we've identified there is a problem and she's got refeeding syndrome. So with treatment, it is better. However, as I've explained earlier, it can be quite fatal.
Right. So we do need to act quite quickly then.
Yeah.
Okay. Right.
Did you have any other questions for me?
No, I mean, would she be able to come back out into the community sort of once she's better?
Yes, once she's better, then we would be able to treat her in the community. But like I've explained to you, the first management is to get her into hospital and to treat her. I've obviously given you a lot of information, so I would like to give you a leaflet so you can read more about the refeeding syndrome and the management. And just to summarize, I mean, Laura, thank you for talking to me today. From what we've discussed, I've informed you about refeeding syndrome, and then I think Alicia's probably showing signs and symptoms of refeeding syndrome. And I've explained to you that it's an emergency that we need to bring her into hospital.
Sure. Okay. Thanks for your help, Doctor. I mean, I'll just go and phone her mother immediately and get to bring her in.
Okay. Thank you. Thanks so much, Laura.
Thank you.